If you're an adult with hypertension, you have a threefold increased risk of developing heart disease. And shockingly, if you're middle-aged and diagnosed with hypertension, you have a 45% chance of developing Alzheimer's type dementia. There's millions of people taking blood pressure medication, and just because they're on medication, it does not mean they're well controlled. The CDC estimates that only 1 in 4 people with high blood pressure have their blood pressure under control. I'm Dr. Rajani, and in this video, I'm going to show you simple, natural steps that you can take to control your blood pressure. The likelihood is that if you're diagnosed with hypertension, your medical provider will do an initial evaluation looking for any obvious causes of blood pressure issues. But we shouldn't forget there can be some associated conditions like metabolic syndrome or sometimes medication like anti-inflammatory medication or steroids or even certain antidepressants which could be provoking a blood pressure issue. Let's talk about first steps to get your blood pressure down naturally. We know that the more salt or sodium chloride that you eat, the higher your blood pressure tends to be. And we know this from multiple clinical trials. But there's a huge variation as to how much we can tolerate and how much people actually eat. In the Yanomami tribes in the Brazilian rainforest, they only eat about 200 or 300 milligrams of salt per day, which is quite a small amount. Whereas in northern Japan, people often eat 15 or 20 times more salt than the Yanomami tribes. So how much is actually safe? Well, the American Heart Association suggests eating less than 1,500 milligrams per day, whereas the US dietary guidelines suggest eating about 2,300 milligrams per day. That's about 1 teaspoonful of salt per day. I generally say about 2 grams or less to my patients. And the reason is because I think whilst the American Heart Association guidelines are scientifically based, they're also very tough to follow. And so the incremental benefit that you get from dropping from 2 grams to just 1.5 grams per day isn't huge. And so I generally say eat about 2,000 milligrams or less per day. Now, if you're Black, if you're a senior, or if your diet is deficient in potassium, you're going to be more sensitive to high salt diets. So be careful, especially if you fall into one of those groups. We talked about sodium and I told you we'd come back and talk about potassium, which I love to do because it's often overlooked, and in a patient with resistant hypertension or stubbornly elevated blood pressures, it can help them get the blood pressure back under control just by making sure you get an adequate amount of potassium in your diet when it's safe. The amount of potassium recommended per day is about 4.7 grams, and foods that are rich in potassium naturally include sweet potatoes, tomatoes, avocados, lentils, and cooked spinach. The reason that potassium works is because it helps us get rid of excess amounts of sodium. It's also directly linked to the amount of chloride in our bodies. Some of you might have already guessed what I'm going to talk about next, exercise. And I'm going to be brief here. In a few moments though, I'm going to share with you a type of exercise you can do that will only take a few minutes a day, and for many people it will start bringing their blood pressure down very quickly. But on the whole, as long as you're given the all clear, the type of exercise that seems to have the most evidence behind it is aerobic exercise. So doing 30 minutes of exercise 5 times a week is probably a good goal to shoot for, as long as, again, that you're safe to do that. Some people will say, well, what about walking? Does that count? Brisk walking is what I typically say, and then the next question is, what does brisk mean? So if you're walking along and you find that perhaps you're trying to have a conversation at the same time as walking, if you're finding that you have to pause and take a breath as you're walking at that kind of pace, so it's kind of making you want to have to take a little breath and not talk in a continuous way, then you're probably walking briskly for you. Now at this point, I want to share with you supplements you can take and small changes to your diet that you can make, which will actually bring your blood pressure down. These are proven by research, and magnesium taurate is one of those. Magnesium taurate, 1,000 milligrams a day, Journal of Hypertension, 1998, showed taking magnesium as supplement over the course of 6 months will actually bring your blood pressure down. It improves endothelial cell function, and that probably is part of the mechanism by which it works. Folate supplement, similarly, will also improve blood pressure control, 1,000 micrograms per day, and then adding fiber to your diet, although that benefit seems to be more in those people over the age of 40. Flavonoids are a very specific thing that will also help bring your blood pressure down. Black tea and fresh fruit and vegetables are good sources of flavonoids, but also taking hibiscus tea seems to be very helpful too. Hibiscus is very rich in flavonoids. Brewing your hibiscus flowers correctly is helpful. So boil your water for the hibiscus flowers, let it sit for a couple of minutes to let it cool down, and then proceed and steep the hibiscus flowers for about 5 to 10 minutes. You can steep it for longer if you prefer a stronger flavor. You should also make a special note that substituting refined carbohydrates for plant-based proteins will also bring down your blood pressure. Remember, following a low glycemic diet will probably be helpful here too. For men, drinking more than 3 drinks of alcohol per day, and remember this is beer, wine, any hard liquors, any type of alcohol really, and for women drinking more than 2 drinks of alcohol per day, we know that it has an impact on your blood pressure over multiple clinical studies. So again, if you have high blood pressure and you're drinking more alcohol than you should consider cutting back. Similarly, caffeine can have a big impact on your blood pressure. It tends to cause spikes in your blood pressure. So if you're noticing that you've got spikes in your blood pressure and you're drinking multiple drinks of caffeine, again, please consider cutting back there. I can't tell you how satisfying it is to see a patient bring their blood pressure under control just by losing weight. If you're overweight and drop your weight by about 1 kilogram or 2.2 pounds, it equals a drop of blood pressure by up to 2 points or 2 millimeters of mercury. I've had many patients successfully be able to drop their weight down and then be able to cut back on their medication, sometimes be able to stop their medication for blood pressure altogether. Now we said we'd talk about a simple exercise you can do for only a few minutes a day what will bring the blood pressure down. It helps endothelial cell function and we know it's clinically proven. And yet this exercise is little talked about in doctors' offices. But I think in the future, doctors will be talking about it much more. Pranayama style yoga has been well established to bring down blood pressure. It's been shown in many trials to bring down blood pressure by improving respiratory function and helping strengthen diaphragmatic breathing. During the global pandemic, there were patients getting respiratory training and diaphragmatic breathing was encouraged. In the Netherlands, a study showed that these patients getting this type of training were actually dropping their blood pressures. This was also reproduced in a study at the University of Colorado. I'm going to leave some explanation in the description on how to do these exercises. Take a look and discuss it with your provider and see if it's safe for you. I'm Dr. Rajani. Thanks so much for watching. I really hope you found this video helpful. If you enjoyed it, please give me a like by clicking the thumbs up button below. Remember to subscribe for future health tips.